This video will show you how to access your practice schedule from your physician desktop. While you're in your desktop and you're ready to see a patient, on the right-hand side, you will click the button Practice. Any patients that you have scheduled for that day will show up under your practice schedule. In this instance, there's a 9 o'clock patient scheduled for you to see. For a full day, you would see your whole list of patients for the day. When you have your practice screen up, you'll notice that you can see all of the information about your patient, the time of the appointment, the patient name, the date of birth, the reason for visit, the provider who the patient is scheduled to see, and the status will show you whether the patient is actually arrived in the office. If it's prior to their appointment, under this status it will say booked. Once they are attended at the front desk and ready to be brought back by your nurse, it will say attended. Once the nurse sees the patient and has them ready for the physician, it will say queued. So from this screen, when you are ready to document on your patient, you will be sure that your patient is highlighted. And you can go down to the bottom right and click on Open Charts. This will bring up your patient record. It comes to the summary page for review. That's the first page that you will see. On this page, you'll be able to see vitals, you'll be able to see if there's any allergies or adverse reactions, and any of the history on your patient. It will show you the last office visit. If there was outpatient visits to a lab, it would show you that. It will show you any problems that are on the problem list, whether they're current problems or if they're historical problems, it will show there. You can do a quick review of your medications, of any immunizations that may have been administered or that were due, any results of diagnostic tests, and any upcoming health maintenance that's needed. For a pediatric patient, you would be able to see your growth chart. Any questions about substance abuse, alcohol, tobacco will be seen there. Any procedures that may have been done. There's also a section for My Personal Notes. This is a section where you can put notes in and no one else would be able to see them but you. If you wanted to put something specific about the patient to help you remember, or something that you like to ask the patient about, you would be the only person that could view that there. You can also find demographic information, insurance information from this summary screen. Again, this would be the first page that you would go to when you're ready to document. You could also, down the side, the right side here, there are function buttons. If you wanted to just see practice notes, you would click on practice notes and it would show you dates of service, what they were seen for, what provider saw them, and the reason for visit, why they were there. If you wanted to look at any of those visits, you could click on the report tab and it would pull up your documentation. This is showing that there was a task for that day and it was completed. You can hit your return button at the bottom and it will take you back to those practice notes. If you wanted to view your med list and make any entries, you could click on the med list from here and you would be able to see a full list of any active meds, any discontinued meds on that patient. It also tells you the pharmacy from here. If you wanted to make any changes, you would hit modify. You can go to the next tab, which is your problem list. Again, it shows you your problems, whether they're from a recent visit, anything that would be historical problems, or medical record history. You can put a provider in who is responsible for this problem. So if it would be a specialist, you could enter the provider name there. It also tells you the date that that problem was entered. There is a health history button where it has different, it goes through the different systems and lets you know if there's anything that was pertinent to the patient information. Any pertinent positives, you can go through your systems and see any answers that were answered in your past family social history on this patient. And as you see, you can click through all of the tabs. You also have a vitals tab, and this will graph your vitals according to visit and by time. Your health maintenance tab will compile any health maintenance based on age, diagnosis, and this is pulled from evidence-based data through Zincs templates. You can add or update per patient, and you can document any visits when they've had a certain testing done, and it will show you the next time that the testing is due. It also shows you immunizations in their tab, so if there's immunizations that this patient needs, you would be able to find that here. Once a series of immunizations is complete, it will no longer be visible. If there are immunizations that you needed to add, you can modify and you can add any kind of immunization from the Add Items button. So if your patient needed to have Hep A, you can click on Hep A, click OK, and it will pull Hep A into your immunization tab. You can enter the date that it was done, and the next time for the series will show up. If there is a set of immunizations that you wanted them to have, you can go in under Sets. Twinrix appears in your set. You can click on that, click OK, and it will pull in the Hep A and Hep B from Twinrix at that point. Special Panels is the next tab on the right side, and based on disease process, if there were any special panels that you wanted to check on your patient, they would appear here. If it was a patient who had a cardiac history and there was any cardiac information, you can pull it through into the special panels. It will show you a quick glimpse of anything that may need to be monitored. Your next section is laboratory. Any of your laboratory data on the patients will be pulled through here. This should be similar to viewing laboratory information on an inpatient side. If there were microbiology reports, you would see that. Pathology, imaging, those are not in this patient record, so there's nothing to view right now. Other reports would be data from anything other than those categories. You would be able to pull up all reports. You can highlight your report and view the information. This is a practice note, so it is showing you on this other reports what the practice note was. You can click return to get back to your prior screen.